I want to disclose to you that I come to this with some biases to begin with. I come with a very deep conviction that a statement that John Breer made some time ago, he was a child psychologist, said, if we could somehow end child abuse and neglect, within 2 generations we could reduce the size of the DSM to a pamphlet. And I believe that that is in fact the case. That we can, if we were to be able to prevent the kind of cruelty that happens to children intentionally and unintentionally, and to all of us who've suffered in our lives, we could reduce the size of the DSM to a pamphlet. It's a metaphorical kind of thing, but I think it's true. I also have a very deep appreciation for the ACE study, which I'm going to focus on this morning. The ACE study has affected me both personally and professionally. It's aided me in really understanding in a more positive and normalizing way many of my own feelings and behaviors, and also the feelings and behaviors of others, both children and adults. And with this understanding comes empathy and compassion, and also a sense of not being so alone in this whole process. The third bias I have is that we in the mental health field today are sitting on the edge of a paradigm shift. It's very uncomfortable to be in that position. It's as dramatic as the shift from perceiving the Earth as the center of the universe to knowing that we're just one of the planets going around the sun. The shift we're making today is basically from what is wrong with me or what is wrong with you to what happened to you or what's happening to you. Whole different thing where we are respecting the context of a person's life and not simply looking at them as a diagnosis and immediately jumping to what's the drug that goes with the diagnosis. So one more little bias here, something about hope and healing, is that we really need to start looking at programs that exist that are really working for people with so-called serious mental illnesses, like the one I just learned about in Finland, Western Lapland, where they've been able to, at first episode psychosis, for example, when somebody has a psychotic break, when they go there, they've been able to almost eliminate what's called schizophrenia from the entire region. And they do this through a trauma-informed approach, by really understanding what's going on in the context of a person's life and not putting down hearing voices as something that represents an illness. It's a way of giving meaning to what's actually happened in that person's life. It's their way of understanding and working it out. And it can be used as very much of a healing kind of tool, if you will. Now these are a few, I'm a reader and I love to read, and these are a few of the authors that I've really enjoyed reading, and they've helped me to understand a lot about the impacts of trauma. I'm not going to go over them all, but one of them is Bruce Perry, that guy, second from on the left. He wrote a book that has really blown me away, and it's called The Boy Who Was Raised as a Dog. I don't know if any of you have heard of this, but it's really interesting. It's not one of those academically boring kinds of, or difficult to read kinds of books. It is a book that includes stories of the children that Dr. Perry has worked with, and then as he tells the story of the child and of the parents, he talks about the neurobiological underpinnings of what's going on in a way that I could understand, and in a way that brought it to life because he's relating it to real lives of children and of their parents. So it really helped me to understand, both for myself, very importantly for myself, the impacts of my early childhood on my nervous system and on the things that I experience and the memories that come up for me from my body, and not just those explicit narrative memories. So I just find it very, very valuable, and I think you would too. So he's one of the ones I suggest. Judith Herman, where is Judith? She is, okay, she's down, I don't have a pointer, but she's one of the blue, next to Sandy Bloom, next to Sigmund Freud in the middle there, okay. She wrote a book called Trauma and Recovery that is really about the healing process and talks about the grieving and the things that people need to go through to actually experience what many of us call transformation or even transfiguration, becoming strong at the broken places. You're never the same after abuse as you were before. You become transformed, and this can be a very good thing, and it's also a very, very difficult thing. The other person is somebody I just discovered on Mad in America website, Monica Cassini. I don't know if any of you know about her, but she is an eloquent writer, and she writes on the website that Robert Whitaker got started, and she writes about her experiences in recovering. And she got every label in the book. She was in and out of institutions, the whole number, and she's really gotten her life back. And she's totally off of medications. And she talks about the process, what that was for her, and how careful you have to be to do that, but how it is possible, and how she, has basically regained her life. So that's a wonderful one. And then Robert Whitaker, who you all heard, is the guy who's second from the right on the bottom. Did you all hear him yesterday? Yeah, yes. He is a person that is, unlike I'm very emotional, he keeps his emotions much more under control than I do. And he's very level, and he's very scientifically grounded, and he's got this incredible memory. He can remember all of these things. He's an investigative journalist, basically. And so he has written a couple of books. They're both worth reading. One is called Mad in America, and the other, I forget the name of it, but it's something like Born in Love or Born to Love, which is, I haven't read yet. I would certainly recommend that you pick up his first book, Mad in America. Okay, let's go on here. And these are the faces of some of the leading thinker and influencers in the neurobiological realm, because it's the neurosciences now that have really stabilized and given much more strength to the findings from the ACE study, which are remarkable in themselves. But the neurosciences have reinforced those findings. So there's really, between the two kinds of research, epidemiological and the research that in the neurosciences, they tell a story that really can't be ignored. It's just way too compelling. There's too much evidence that we need to change the way that we're doing things based on the new knowledge that we have today. Some of the websites on the ACE study, the one I would recommend the most highly is called ACEs Too High. And you just plug that in. Again, I don't know, these investigative journalists are doing a great job, but the gal who runs it does come from that discipline. And what she does is she writes very well, and so you get a lot of information that's easy to read. And you don't have to plow through some of these research articles that are really hard to read, plus they cost a fortune to get often. So, and it keeps you in touch with everything that's going on all over the country. And it's very exciting to read how the attention to trauma, attention to the total context of our lives is really catching on in so many places. Unfortunately, the mental health field appears to be one of the hardest to influence, and that's probably because there's been so much training in a different model. But the healthcare fields are making huge advances, education of children, education of parents, all of these kind of public health approaches are really making a difference, so that those of us who suffer from the impacts of trauma and from being diagnosed all kinds of different things, if we were born into the world today, we might have a much better chance of not having gone down that road. This is a picture of my daughter. And it's a picture, she said this, maybe someday someone will come along and understand me, and they won't just say drugs, drugs, drugs. And she said this in the middle of writing a book with me about her life. And she was a trauma survivor, and I'm not going to say any more. I'm just going to go right into telling you her story. And her story is best portrayed by this. Now, I want to tell you ahead of time, this is a tragic story, and doesn't mean that we all end up this way at all. There are many of us who don't, but there were a lot of factors in Anna's life that contributed to the tragedy of her life. This is a picture of Anna on the left at age 1.5. And the one on the right is a picture of Anna years later in a mental institution. And as many of you know, she was on multiple cocktails of drugs at the time. At less than 3 years old, Anna was sexually abused. The abuse was severe, sadistic, and perpetrated by a trusted caregiver, occurred at a very early developmental stage, and continued for nearly 4 years. None of us were aware of or intervened in what was happening to her. She did not have the language to tell us. Some of it was pre-verbal, and we did not recognize the signs at all. This was in the 1960s, when sexual abuse was never spoken of or asked about. The only people probably who even knew about it were those who were victims of it. And they weren't speaking at that time, or if they were speaking, they weren't believed. Numerous additional traumatic events occurred throughout Anna's childhood and adolescence, overwhelming her already severely compromised resiliency. These included her experiences with my alcoholism and depression, serious depression, her father's violence, and a frequently chaotic family environment, which included many moves and temporary abandonment. And the other thing I can add to that, which I just learned from preparing for from studying some of the neurosciences, was that I was really not a mom who knew how to attach. So she didn't get that early holding. And many of us miss that. In fact, what I'm told by the research is that about 50% of us have that hole inside of us. And the hole was caused by the fact that we didn't get what we needed when we were little tiny infants and children. So her 4 siblings, Anna's 4 brothers and sisters, none of whom had experienced child sexual abuse as Anna did, were resilient enough to survive and thrive despite these traumas. Anna, however, broke at the age of 13, was misdiagnosed schizophrenic, and at age 15 began psychiatric treatment. Through her childhood, adolescent, and teenage years, she interacted with multiple health and human service systems, and many good individuals tried to help her. But no one asked about or looked into what might have happened to her. Rather, the focus was on what was wrong with her. Was she learning disabled? Did she have a mental illness? What was her diagnosis? How can we control her symptoms? What kind of medications should we use? Totally off track. After 17 years, she was in the mental health system. 11 of those years she was in psychiatric institutions. She did not drink or drug, but she did self-harm and made multiple suicide attempts. During periods of homelessness, she would steal food and other items and confront people in a threatening way, bringing her into contact with the correctional system. At times, her rage and her fear would overcome her. Though never physically violent to others, she would attack with words and destroy things. She was always suspicious that others were out to hurt her, for good reason. For 17 years, no psychiatric treatments, alternative therapies, mental health services, or medications helped her. In fact, much of what passed for treatment triggered, re-traumatized her, and made her even sicker. Although there were things, I take that back, she did appreciate at times the medications for depression. But she was so bombarded by cocktails of multiple medications that it was hard to assess what any of the impacts were. When she was 23, she learned for the first time from other patients in a hospital, not from staff, that she was not the only one in the whole world to have been sexually abused. She thought she was the only one for 23 years. And therefore, she thought she was bad, she thought she was something wrong with her, and so on and so forth. She didn't know that it happened to other people, many, many other people. Throughout her long history in the mental health system, although she requested help for her trauma and diagnosed herself, she was sharp as Dickens. And she read about and she diagnosed herself to have PTSD. Her requests for treatment for that were ignored, and she was never assessed for it. When she attempted to communicate the awful things that had happened to her, there was nobody really to listen to her, understand, or help her. No one had trauma training then. And the system was not financially or in other ways structured to support that kind of care. As a result, she was continually misdiagnosed and considered to be chronically mentally ill. Her treatment was most often coercive, involving abusive environments, drugging, restraint, seclusion, etc., and she felt alone, unseen, and unheard. She took her life October 24th, 1992, at the age of 32, on the back ward of a state mental hospital. Now, the emotional cost to us and her family, of course, was high, and the lifetime financial cost of her care was almost $5 million. Not that we paid that, but I mean, that was figured out by some fiscal people that I asked to help me with it. The majority of people today in our mental health, substance abuse, human service, and correctional systems can tell similar stories to Anna about their life histories. Though the lives of many and most do not end up in the kind of tragedy my daughter's life did, the impacts of traumatic childhood experience, when not recognized, intervened, or responded to, and when not shared with others who've had similar experiences so that you don't feel so alone, can be severe and can last for a lifetime. And this is what the ACE study so clearly demonstrates. Now, what I do want to say, and I realized as I was relating Anna's story, that this can be difficult stuff to listen to, and I just wanted to remind you that it's important. We all know how we have to take care of ourselves. I mean, I've already got it set up when I leave here today, how I'm going to take care of myself this evening. You know, we have to figure out what to do to keep our nervous systems under regulation, right? And all of us know how to do that one way or another. We have a friend to help us. And I want you to keep that in mind as you hear some of the difficult material. You do have the resources within yourself and with your friends and the people that you know and trust to deal with that. So if you want to take a break and you want to go get coffee or, you know, just go somewhere and sit quietly for a while, it's fine. I'll totally understand. If you walk up and leave, you know, I'll totally understand. That's fine. Okay, this is just to give you an idea of all the missed opportunities as Anna was growing up, all the people who could have helped her, including and primarily her parents, me, and her dad. If we had been educated, if we had known anything about these issues and about what traumatizes children, not just the sexual abuse that happened, but all the ways in which we were traumatizing her and her brothers and sisters. If we had known that, we would have done it differently. We would have done it better. And there are programs like that today, and they are helping people enormously. But so it starts with the parents, but also the extended family, the family doctors, people in the healthcare field, the church, people in the community, the pediatrician, the obstetrician, all these people missed it. The child psychiatrist missed it completely. Nursery school teachers, public school teachers, again, school counselors, private school teachers, family doctors, mental health organizations, the community mental health psychiatrists, special ed tutors, psychiatric nurses, children's psychiatric hospital staff. You go through her whole history. There were multiple opportunities to help Anna and to help her deal with the impacts of how she had been so traumatized. But they were totally missed. And that's why the ACE study is so important, because what it's doing is it's really pointing out that we need a public health approach. Yeah, we need to help ourselves heal. Yes, that's really important. But we need to start focusing on how we can prevent this stuff from happening to people, because it's crucial that we do. And there are ways of doing it, and there's been success in doing it too, and that I'll relate to you later on in the presentation. We've just got to stop the kind of abuse and neglect that goes on of our children. We've got to stop it. Okay, so this is what's in the first column. And what the ACE study did is they took their questions really based on the experience of the people in their healthcare system. And so these were people with health insurance. Most of them had an education, and they were fairly middle-class people, most of them. And so they didn't include things like street violence and extreme poverty and the kinds of things in our lives that really do result in a lot of stress. They didn't include a lot of different things. They included those that were mentioned most often by the people in their own services. Okay, and that included emotional abuse, physical abuse, contact sexual abuse, emotional neglect, physical neglect, alcohol and drug use on the part of the parents or somebody in the household, depressed family member, mother treated violently, domestic violence, an imprisoned household member, and the loss of a parent through one way or another. And these were very, very prevalent. They were surprised by the findings. They put out this questionnaire in surveys, and they got a very high rate of response. And by the way, they didn't get any complaints about the questions being asked, which is really interesting, because one of the problems in our field, in the mental health field, is that people are really reluctant to ask these questions because they feel it's going to re-traumatize somebody, or it's going to, heighten their symptoms and so on and so forth. And really, that's proven to not be the case so often. A lot depends on how you ask a question, with great sensitivity. But you've got to open the door and give people a chance to tell their stories. Without that, how are you going to relate to them as a human being? You don't know what's really gone on in their life. So what they're finding, and this is, again, people who aren't in the mental health system, more than 1 to 4 grew up with substance abuse. 2/3 of the middle-class population had experienced at least one category of ACE, and ACE stands for Adverse Childhood Experiences. 1 in 6 had a score of an ACE score of 4 or higher. 27% experienced alcohol drug use by a household member, and 25% of the women reported sexual abuse as children. That's like 1 out of every 4 women in this room. And 17% of the men, which is probably on the low side of reporting, because men, when this study was being done, very reluctant to report having been abused as children, reported this kind of abuse as children. So it's very, very common. Now, the people that they interviewed and surveyed were 80% white, 10% black, 10% Asian, evenly divided men and women. 74% had attended college, and 62% were age 50 or older. So you're talking about a group of people that had been with Kaiser Permanente, this healthcare system, for years and years and years. So what they were able to do in the ACE study was to take the results of these, ACE scores that people had and what had happened to them in childhood, and then look at their extensive healthcare records of sometimes over 50 years of involvement in the Kaiser Permanente system. So they had a lot of ways of checking out, the relationship between these adverse experiences and the kinds of illnesses and healthcare problems that came up. And along the way, of course, they discovered incredible other kinds of information from people's medical charts, and they're still analyzing the data. I mean, this is a very, very large study, and it's very, very revealing. They discovered not only were ACEs common, but they're also highly related, so that if you have one ACE in your childhood, probably you have 2 or 3 or more. In column 2, there are the neurobiological impacts, which include disrupted development, of course, anger, rage, difficulty controlling those kinds of emotions, hallucinations, Depression and other mental health challenges, panic reactions, anxiety, somatic problems, impaired memory, flashbacks, dissociation. I would say for myself, I've had problems with the anger and rage. Depression is a big one for me. Panic reactions, anxiety. I mean, you can go down the list of these things. These are neurobiological impacts. And we all experience them if we've been traumatized in childhood. It's a normal reaction to having been traumatized. It's not an illness. It's a normal reaction. Okay, going on again for the second part of the second column, the health risks are high. And these are not, the ACE study looked at these things and they said, hey, these aren't symptoms. These are ways of coping. People are using these things to regulate themselves. They're using these things to soothe themselves because they're in this state of hypervigilance and anxiety and pain from the things that occurred to them that have probably never been addressed. So smoking is a great soother. I mean, I did smoking for about 30 years. It worked. You take deep breaths. Now I learned how to do that through meditation and other means, but smoking was a way that I could take really deep breaths, and it helped. In fact, it's helping me right now. Obesity is another thing. Comfort foods. I was so anxious about doing the presentation on the brain because I had never done it before. I went through so much anxiety, I gained 15 pounds. Believe it or not, I gained 15 pounds. I went from 150 to 165. Feeding myself and I fed myself a lot of junk food too, ice cream, potato chips. I mean, and it helped. I got through writing that darn presentation. I did it. Now I have to go home and diet for about half a year to lose the weight. But it helped. These are coping mechanisms. Even such things as suicide attempts, that's a way of coping. Can't stand the intensity anymore. Self-injury. Repeating traumatic events to get some control over them, eating disorders, physical inactivity, all of these things are ways of coping. They're not, in fact, Robert Anda, one of the co-investigators of the ACE study, does something very unusual in some of the groups that he talks with. He has half the room decide that they are people who use alcohol, and then he has the other half of the room decide that they're not. They never use alcohol. And he asked the half of the room that are not to get up and applaud for those who do use alcohol. And he said they're coping. They're trying to cope. They're being honest about trying to cope with this. And I don't know if I've reported that in the right way. It doesn't feel right to me. But it's like the things that we do, we've got to keep thinking, stop thinking about them like there's something bad. Our illnesses or bad behavior are putting each other down for doing these things. We've got to start understanding why. These things, they help. It's like people who are in a state hospital. For God's sake, they cut out smoking. What else have you got? Smoking can help you to soothe yourself. It can help you feel better. It's even used as a reward kind of system, in a hospital like that. So I don't agree with it, although I don't allow smoking in my little rental that Artie was talking about. I would certainly not think twice about taking it away from people who are in a mental hospital, and certainly would try to introduce people to other ways that they can soothe themselves, other than smoking if they want to quit. But you don't just say smoking is bad and you have to stop. That's BS. Okay, sorry about that. All right, here you come to the long-term consequences. I won't spend time on these because I'm going to cover them later on in the presentation. And a bit of reassurance for those of you who have a high ACE score like I do. Remember that higher ACE score numbers just show an increased probability of particular outcomes. They do not predict the outcomes. They just show an increased likelihood that you might suffer some of these long-term outcomes. Also, individuals are unique. Not everybody is impacted in the same way or to the same extent. Okay? ACE findings do provide a tool for understanding how many serious health, behavioral health, and social problems develop. And they lead to more effective ways of coping and responding. What this ACE study has done is cause a lot more attention to be paid to prevention and early intervention, which, makes perfect sense. And they also indicate how I've already said that, how vital prevention, early intervention, and trauma-informed kinds of treatment are. This pyramid is just another way of looking at the ACE study. I want to make sure I don't get too far out of line here. Okay. And these are some of the long-term impacts. We've already gone over emotional pain, persistent mental health problems, health risks, serious social problems at times, chronic disabling health conditions, and poor life expectancy in some cases. So let's go over some of the emotional kinds of issues. Childhood experiences and trauma underlie chronic depression. The ACE study found that adult men and women with an ACE score of 4 or more were 460% more likely to be suffering from chronic depression. They underlie suicide, and although this is a heavy topic, I'm going to focus a little bit on it because I'm really concerned about the suicide prevention programs that we have out there today. They're not working, and we need to take another look at them. The likelihood of adult suicide attempts increased 30-fold, or 3,000% with an ACE score of 7 or more. Did I go over already what an ACE score means? How it doesn't mean if you were physically abused as a child, for example, and you were physically abused 250 times, okay, you still just get a score of 1 for physical abuse. If you were sexually abused countless times, you still get a score of 1 for that. If you witness domestic violence in your household and that happened more times than you could count, that still gets a score of 1. So your ACE score represents how many different kinds of adverse experiences or trauma. Is that clear? It doesn't mean how many times. We'd be up in the, thousands, right? We just couldn't keep count of that kind of thing. Okay, so the likelihood of adult suicide attempts increased 30%, or 3,000%, 30-fold, 3,000%, with an ACE score of 7 or more. And childhood and adolescent suicide attempts increased 51-fold, or 5,100, with an ACE score of 7 or more. Now, in the field of epidemiological research, this is hugely significant. This cannot be ignored. So the ACE study found that 2/3 of all suicide attempts, 64% of adult suicide attempts, and a startling 80% of child and adolescent suicide attempts appeared to be or were attributable to cumulative childhood traumas. And they found that childhood sexual abuse of the many types of childhood trauma is the strongest and most independent risk factor for suicidality, accounting by itself for between 9 to 20% of all suicide attempts. And this is most strikingly demonstrated among young American Indian and Alaska Native girls and women. In the general population studies, we find between 1/3 to 42% of women or girls are sexually assaulted before the age of 18. Very common experience, very common. By comparison, nearly 80% of American Indian, Alaska Native girls are sexually abused in early childhood. And the relationship of child sexual abuse then to suicide becomes apparent in the fact that among all young females between the age of 5 to 34, young American Indian, Alaska Native girls have the highest rate of suicide, over 3.5 times as high as in the general population. So my point is here, and the reason I emphasize this, is that any program that seriously aspires to prevent suicides over the long term must openly speak about adverse childhood experiences during childhood. The tendency is to kind of want to protect the families who are really upset if their child has attempted suicide, and they don't want to further traumatize the families, and it's a difficult topic. But if we don't open the door, we're not reducing the rate of suicide long term. And somebody as respected in the field as the director of the National Institute for Mental Health there's a little chart in here that I'll show you in a minute. In spite of all our best efforts, the rate of suicide has not gone down in this country. And I think it's because we're not addressing the roots of what's happening with people who feel that badly about their lives. And this is the chart that he uses. This is Dr. Thomas Ensel. From 1990 to 2010, there were impressive decreases in mortality from strokes, AIDS, heart disease, and leukemia. And there was absolutely no decrease at all in the rate of suicide. So that tells you something. We're not doing something right. Iraq combat veterans, the ACE study found that those who developed chronic PTSD had histories of high ACE scores in their lives. So it wasn't just the combat. It was also the fact that the combat was trauma piled on top of trauma, piled on top of trauma, which is why I come down so heavily on the institutional, the coercive care that's being promulgated even more now than in the past. You know, outpatient commitment kinds of things, the coercion of medications, the coercion of restraint and seclusion. All of these things are very much like somebody who's gone into war, a combat zone, a war zone, and getting re-traumatized. Because many of these kinds of practices really replicate the powerlessness and in some ways sometimes almost replicate the details of what happened in an individual's life to them when they were children. And so therefore, it's like they're getting piled on with one thing after another. And it does. It's hurtful. It's very, very hurtful. So that's another thing we have to change. There are a lot of things we have to change, right? It's going to take time. But a lot of it is really based on how we see and understand people, you know. And if we can see and understand people for the reality of their lives, and if we can see and understand people in a real way and not just a symptom-based way, then we can have that understanding turn into compassion and empathy, and we can begin to do some real solid healing. But not until then. Okay, are we misdiagnosing? This is the ACE score. Notice in all of these charts, they call this dose response. You know, where the higher the ACE score, the more the likelihood is of developing some of these things. In the case of hallucinations, compared to people with a 0 ACE score, those with 7 or more ACEs had a 5-fold increase in the risk of reporting hallucinations. Now, for those of you who hear voices, I'm not going to ask for a show of hands, but for those of you who hear voices, this can be a wonderful tool for healing. It's not necessarily a symptom that you've got to do away with. You know, there's a website, and it's in your list of resources. It's about hearing voices, and it was started in England, and people communicate back and forth and talk about how hearing voices can be used as a tool for recovery and for survival. So, and it's very common. There are many, many people who hear voices who never end up seeking mental health care. And remember the story of Robert Nash, the movie, A Beautiful Life? You know, where they portrayed in the movie that he recovered and got better because of medications. I heard him speak personally, and he refuted that. And it said that in the movie, the wife of the producer was very tied into the medical model and wanted that in there. But the fact of the matter is, he did not get better until he stopped the medications. He learned how to work with his voices. And he learned how to use those voices, and he learned how to focus in different ways, in spite of the voices. So, you know, we've got to be a little bit careful about how we perceive some of these things. And, you know, if you have some of those things going on, if you can view it as a strength to be harnessed, instead of, you know, with my anxiety, when I wake up in the morning with that pit of anxiety in my stomach, I say hi. You know, here you are again, friend. You know, let's see how you and I can work together and get motivated to finish this task that we have to finish. You know, I mean, I talk out loud to it. You know, you should be around my house sometimes to hear me talking out loud. But, you know, it works. Whatever works is really, really what we need to do. All right. Whoops, I didn't mean to include that. This has to do with childhood experiences underlying serious and persistent problems in mental health. And what the research is showing here, well, what the ACE study found was the higher the ACE score in each one of these examples, the higher the use of medications. So that implies, you know, the higher the kinds of mental health conditions that arise. What other research is showing is that between 52 and 98% of adults with what they call serious mental illnesses, such as schizophrenia, bipolar, etc., and 93% of adolescents in psychiatric hospitals have histories of severe childhood physical, sexual, and emotional abuse. They've been overwhelmed by toxic stress, and they need help with that. Okay. Again, what we do in our system too often is we think in terms of what's wrong with the person instead of what happened to the person. You know, if we could just shift that thinking, you know, as our immediate reaction when we meet somebody, what's wrong with this person, what diagnosis do they have, what they, you know, blah, blah, blah. If we could start just taking some time and listening to them about their lives and asking them questions about what's going on in their lives, you know, then we can really get to what's really going on and how to be of some assistance to them. Now, this is from the work of Judy Herman. Have any of you read her book, Trauma in Recovery? We got one there. Yes, yes. Any more? Great. It's good. It's one of the first books that began to address these issues of sexual and physical abuse and what their relationship is to emotional distress later on in life. And what she said in the book, and it's a whole lot more than this, and I left out some of the slides because it would be too long, but things get altered when you have these experiences. Affect regulations, you know, the ability to contain our anger, or to keep from getting too depressed, these kinds of things get affected. Alterations in consciousness, our memories, amnesia, dissociation at times. Alterations in self-perception, which is a huge one. I mean, how many of us suffer from very, very low self-esteem? I mean, I'll be working on that till the end of my days, and I'm 77 now. You know, I'm still working on the self-esteem issues, you know, the sense of being not bad or something's wrong with me and that kind of thing. Helplessness, paralysis, shame, guilt, a lot of guilt, self-blame, being stigmatized, complete feeling really different from other people, and so on and so forth. Alterations then in perceptions of perpetrators. Sometimes people who are abused sort of bond with the perpetrator, and if it's a parent, they don't want to think of that person as being, you know, really doing a very, very criminal thing towards them. So they'll kind of make up a story and forget about it. And you know, my former husband, who was very, very violent, and bless his heart, as he aged, he became very, very wonderful, and really who he was in his essence. But he had been treated extremely brutally by his own father, and he never really dealt with that. And as a result, he was very brutal to especially our sons. And he thought of his dad as being the best person in the world. You know, and it wasn't until he bordered on dementia as he became older that he was finally able to say, my dad was awful to me. He was just awful. He did very mean things to me. I mean, he was talking like a child. He had dementia, he was slipping back, he kind of, you know, recovered some of these memories. But all those years, he thought, oh, my dad was tough. He taught me how to be tough. That's why I'm a success in the corporation and blah, 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 you know. Okay, so alterations in relationships with others, sometimes it's really difficult. to develop really good relationships with other people. Intimate relationships can be a problem because there's a whole issue of how much can we trust. And if we haven't experienced good relationships when we were younger, it's really hard to know how to do that. And alterations in systems of meaning. You know, before being abused, life kind of made sense. After abuse, what do you do with that? You know, what do you do with that having happened? And somebody was talking to me recently, yesterday, as a matter of fact, came up and told me this horrendous history in her own life. And she said, you know how I heal? And she said, I had children, and I do it differently with my children. All the things that I missed, she told me, like my mother loving me, and my mother holding me in her arms, and my feeling of being safe with my father, all those things that I missed, I give to my children. And she said, and I'm healing because now I'm giving to others what I miss getting for myself, and I'm doing the opposite of some of the things that were done to me. I thought that was very wise. Oh, I did leave these in. Huh. Okay, sense of helplessness. These are some of my daughter's artwork. And Pam was asking me to please continue having these in. So they're here. The sense of shame, guilt, self-blame, being bad. My daughter did all this artwork while she was in a mental institution. And a lot of it got thrown out, but how much time do I have? 8:15, 9:15, 9:45, right? Okay. So these are the changes in self-perception. Remember that I talked about that Judy Herman is one of the alterations. Sense of helplessness, captivity, inadequacy, and so on. Sense of shame and guilt. Sense of defilement, contamination. And a sense of being very different from other people. Very difficult to deal with these. Now, those of you who might be interested in my daughter's artwork, which is very, very powerful, can see it by going to the website, which is also in your slides and in your handout. It's called theannainstitute.org, and there's a whole gallery of her artworks. She managed to get a great many of them out of the hospital. A lot of them were just thrown out. But they're incredible works, and a lot of people who've been through similar experiences have written me just some amazing emails and letters about how they felt less alone and how they saw mirrored in their own lives my daughter's experiences. And for some reason, even though her life was tragic, that seemed to help. Just not feeling so alone. So, how do we cope with this emotional pain? What are some of the ways in which we cope? A lot of the ways in which we cope are probably not so good for our long-term health. You know, my smoking, I'm married to a guy who has COPD. He smoked for about 40 years. He gave it up and then he took up cigars. I mean, go figure. And he also drank for about 35 years. And all of that, you're paying the price for it. But he was sexually abused when he was a kid. And boy, did this help. So here we are. The adverse study found that a child with 6 or more categories of trauma, different types of trauma in their childhood, is 250% more likely to be an adult smoker. It helps. Okay, and of course the smoking also relates to eventual COPD and lung disease. And the earlier you start, the more chances you have at developing long-term illnesses. Now again, you can see the graded relationship here. The higher the ACE score, the more the likelihood of each one of these things. And here we come to alcoholism, which is of course a big one. There's a 500% increase in adult alcoholism that's directly related to adverse childhood experiences. The analysis of the ACE findings found that childhood traumatic events underlie 2/3 of all alcoholism. Teenagers with alcohol and drug problems are 6 to 12 times more likely to have been physically abused and 18 to 22 times more likely to have been sexually abused as children. And again, we see the relationship of the early use of alcohol and going on to becoming an alcoholic and actually marrying somebody who's an alcoholic. Then we have the A score in intravenous drug use, and this is really another one of those dramatic findings from the A study. A male child with an A score of 6 has a 4,600% increase in the likelihood that he'll become an IV drug user later on in life. And 78% of drug injection by women can be attributed to their experience of cumulative types of trauma in childhood. So that 4,600% increase in the likelihood that a male child who has a high A score, who's experienced a lot of cumulative trauma, will become an IV drug user later on in life, that's huge. That's a huge finding. And that's, underscores the reason why we need to help kids before they, we help them not to feel so alone and to heal before they go on to develop these kinds of long-term problems. Another issue, and I might as well disclose to you, I'm disclosing everything else, but one of the things I did to comfort myself was to have multiple sexual relationships. I kept reaching out for comfort and love. And that's what I did. And it was also a way of controlling, because I figured if I initiate it, I'm in power. And this is something that trauma survivors do. If we felt powerless in the past, we're going to figure out situations where we can feel more powerful. And that's one of the ways I did it. But of course, as with all addictions, it leads to different kinds of health problems, which in this case includes HIV and AIDS. I'm very, very fortunate that I didn't develop HIV and AIDS. Very fortunate. I'm one of those lucky people. Social problems. Okay, now keep in mind, not everybody with a history of childhood adverse experience develops these kinds of social problems as adults. In fact, what happens, it's a mixed bag, and we all know this. There are plenty of us who go to work and hold down a job and do a fabulous job, and then we go home and plow ourselves into one glass of wine after another and don't have much of a social life. It's mixed. We can be very, very highly functioning in some ways and very low functioning in others. That's part of the package. So there are a lot of social problems that do develop. This was really interesting to me, and it's why one of the things I recommend for people who have experienced sexual abuse in childhood is a self-defense course. I mean, a really solid self-defense course where they learn how to become street fighters so that they feel powerful in their body, not just that they're being told to be careful and not to walk on dangerous city streets and blah, 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 but they walk differently. They stand straighter. Their body changes when they go through these self-defense courses. I think that's one of the healing things that we can do. Because when you don't learn how to deal with your body and the way it's been treated in the past as a victim, you're usually kind of shrinking within yourself. And perpetrators pick that up. They sense it and they know it and they pick it up. So we become more vulnerable, and what happened, the A study found is that women with an A score of 4+ are almost 900% more likely to become victims of rape in adulthood. And it also underscores domestic violence. Women with an A score of over 4 are 500% more likely to become victims of domestic violence. And just as the risk heightens with a high A score of becoming a victim of domestic violence, it also leads to sometimes becoming a perpetrator of domestic violence. Again, the power that we missed as children being victimized can translate it itself into becoming a perpetrator. It's a way of gaining power over something that we were powerless to do anything about in the past. And here we have the higher the A score, the more teenage pregnancies, the greater likelihood of elective abortions. And interesting finding here was that if a young man, the younger a young man is sexually abused, the more likelihood that he'll end up impregnating a teenage girl. And there's been some pretty, well, I won't go into it. I'm getting too research oriented here, but there has been some interesting findings around the sexual abuse of boys and men. And what they're finding is that the rates are almost as high as those for women. And about 95 of the perpetrators are women for abuse towards men, which, you know, it's one of those things we have to face as a potential reality. Okay, a high ACE score, understandably, because our nervous systems are out of regulation often, and we have a hard time dealing, you know, with stress and that kind of thing. So we have a harder time dealing with a work situation. It's harder to keep a job. There's more absenteeism, and there's more job problems. And here we have the connection to homelessness. Now, undoubtedly, the economic equality that exists in our culture today, which I think is a horrendous kind of thing, is promoting a great deal of homelessness. So a lot of the homelessness we see really has to do with the inability to be able to afford housing. And so this is not to say that isn't a factor. But what the ACE study did find is if a child is neglected, he or she, physically and mentally neglected, emotionally neglected, he or she is 13 times more likely to ever experience homelessness as an adult. And when a child is physically abused, about 16 times more likely to become homeless at some point during his or her life. And they also found that children who suffer both neglect and physical or sexual abuse are 26 times more likely than those who haven't to become homeless during their adult lives. Childhood trauma and adult violence, and I think this is such an important issue today because, you know, all this mistaken talk about people with mental illness being more violent is just such a crock. And thank you. Well, it is, you know. It is. And you know, as Robert Whitaker, I'm sure, talked about, some of it has to do with the misuse of drugs. I'm positive, you know, that that's a factor. Some of the impacts of drugs are really, really heavy. But the fact of the matter is, the research shows that there's not a higher percentage of people who have quote-unquote mental illnesses who are violent. In fact, it's lower, you know, than the norm. So, you know, this is the media's unintended ignorance, I will call it. You know, because they don't have time to do a lot of research and find out what the facts are, so they just mouth whatever, you know, they're told to mouth, and people believe it, and it's not true. What I get concerned about is, and what's really important to look at, so that we can both prevent it and understand and not feel such condemnation towards people who become monsters in adulthood. You know, people like Hitler, people like the bomber in the Boston Marathon, people like the school shooters. They started out as little innocent children. They did not become monsters as an accident or because they were somehow defective genetically. You know, they talk a lot about genes and how they get passed down and how these things determine who we become. And Vincent Fleet, I have to share this with you. I think there's still time. But he had this great image that I always remember. He said, you know, Ann, he said, our genetic predispositions, imagine that you have a gun in your hand, and our genetic predispositions are the bullets and the gun. Guess what pulls the trigger? Okay? The stress. Our life experiences. If we have positive genetic predispositions and we have good life experiences, those positive predispositions are going to flourish in us, okay? If we've got some of those predispositions, like in my family, towards a lot of very, very high mental distress, towards violence and so on, and you couple that with high stress in childhood, you're going to activate those genetic predispositions. So where we need to focus is on the trigger, not the genetic predispositions. I'm going on a bit too long, so I'm going to run out of time. But I think it's important to know this. A seminal study of juveniles sentenced to death found that each individual had suffered severe physical and sexual abuse in childhood. Okay? Another study found that 83.8% of convicted killers suffered severe physical and emotional abuse, and 32% of them were sexually violated as children. Girls and women who become dangerously violent are 2 to 7 times more likely than female controls, they call it. I hate that language, but anyhow, to have been exposed to violence in childhood. Okay? And children from violent homes are 24 times more likely to commit sexual assault, to become perpetrators than their counterparts from nonviolent homes. So, violence just doesn't occur from nowhere. And I put this picture in there. You know the bomber in the Boston Marathon? He's that little baby there. That's a picture of him as a baby. Okay? And of course, everybody was thinking, oh, the monster, to do such a horrible thing, and on and on and on. And, we all tend to condemn and shame and blame and that kind of thing. And if we put on our understanding lens instead of our blame and shame lens, we would begin to ask questions about what was it like for him as a child, He was exposed to war and a refugee life. He had an extremely unstable family. The family was completely deserted by the mother, who went back to Russia. There was domestic violence in the family, continued. Uncontrolled anger, isolation from other people, stigma because of their background. So, let's get real, and get compassionate and understanding. When we have this knowledge, we can start to look at things differently and begin to make a change and begin to realize how important it is to focus on prevention and early intervention, as well as trying to reform our systems. Adult disease and disability. These are the more toxic stress experienced in childhood without interventions that build up resiliency when no adult helps. These are the kinds of conditions that can develop: ischemic heart disease, autoimmune disease, lung cancer, chronic obstructive pulmonary, COPD, liver disease, skeletal fractures, AIDS, recent finding, frequent disabling headaches. One of my sisters had headaches from the time she went to Times Square when she was about 21. And I don't know what went on in Times Square, but she called me and she said, for the first time in my life, I experienced what it was like not to have a headache. She said, my head has been aching as long as I can remember. As long as I can remember. And I won't go into her childhood, but it was pretty bad from infancy on. And she developed these headaches. And the ACE study is now finding that people who have chronic migraine headache types of problems, doesn't mean it's all based on childhood experience, but a good part of it is. So if we want to help people, we need to address some of that. And then we have the risk of mortality, which a lot of people are centering in on, okay, it's caused by the multiple psychiatric drugs and so on and so forth, which I'm sure contributes a lot to it. What the ACE study found was, on average, children exposed, and this is from a population that really didn't include being in hospitals and psychiatric hospitals and so on. These were people that were questioned in the ACE study. Children exposed to 6 or more ACEs died at the average age of 60, whereas children without ACEs died at the average age of 79. So there's a 20-year difference. And it's not all because of medications and treatment. It's also because of the stress that we're dealing with over the years without any real intelligent assistance. This is a slide on the many faces of trauma, all of the things that can happen. The cost of this comes to, according to an estimate reported by the Center for Disease Control in 2011, is approximately $124 billion annually. And in the sensitivity analysis, the total burden is estimated to be as large as $585 billion annually. So by doing things the way we're doing them, with not paying attention to what's going on to our kids, it's costing a heck of a lot of money. But at the same time, you've got to balance that out by the fact that a lot of this is going on is helping some people make an incredible amount of money. So, you know, it's hard to change something when the fiscal system is so deeply rooted in one way of doing things. You know, it's going to take time to shift the paradigm from what's wrong with you to what happened to you, from really seeing the whole person within the context of their life and seeing somebody who's got a disorganized brain or whatever they call it. And I want to talk about that just quickly here. Some thoughts on resiliency. For those of you who feel a little bit impacted by all this bad news, is that ACEs are not destiny, they're opportunity. Adolescent and adulthood is not too late to heal from childhood trauma at all. People have the power to repair brokenness in themselves and in others. And I think we all know that through the peer help, through the websites of sharing like the one I told you about, Mad in America. Increasingly, there's that kind of healing help around. Survivors, kids and adults are not broken. They are brimming with strengths that help them survive. In the workshop I'm going to do this afternoon, I'm going to do an account of reframing some of these experiences where this woman I know talked about a homeless woman who was mumbling to herself, and you know, everybody said, well, we can't have her in this homeless shelter because she's crazy, blah, blah, blah. You know, and she reframed it all, and she said, this is a woman who left her family at the age of 15 because it was a violent family. She had the strength to do that. Imagine doing that at the age of 15. And then she learned all the skills. She's still alive. She lived on the streets for all these years. Imagine what strengths and skills she's learned from that. So beginning to reframe the way we look at people in terms of the ways in which we learn how to cope and to value that in each other. Human beings are built to love. The best way to help others is to face them with openness and love. Resilience is a mindset. When something bad happens to you, do you see it as a catastrophe or as an opportunity? We need help in distinguishing real tigers from imagined tigers. You know, if we've been abused, often I know I do this. I'll get an email from somebody, and right away I'll interpret it in the worst way. I'll get this email, and I'll think, they didn't like what I did. You know, I gave a lousy presentation. And I'll read that email 2 hours later. You know, what I've learned at the age of 77 is not to react immediately. And so I'll go and I'll take a break. I'll get a cup of coffee or something. I'll come back and I'll read it, and it didn't say that at all. Does that happen to you? Oh my God. It's like built in. You know, it's built into my body. It's built into my nervous system that I must have done something wrong. You know, it's right there on the tip of my little anxiety nerve. Okay, so changing that mindset is really important. Post-traumatic growth is entirely possible. And the key to resilience is the presence of love. It's the presence of a caring adult or a caring friend. That's one of the keys. I work with a therapist. I work with a psychiatrist. I love her. She's a feminist psychiatrist. And she's more like a colleague than she is a helper. There's a sense there that we have equal power and that there's none of this slight tinge, and I don't know if you've experienced this, but I have a lot, is going into often a mental health organization. It's just there. It's like I can smell it. I'm super sensitive to it. And I went through mental health training. I went through training as a psychologist. I went through training, you know, in family therapy where you look through the glass and you analyze what everybody in the family's doing, you know, and all that kind of stuff. And I just was so uncomfortable about it. And finally, I read something that helped me to understand it. It's like it builds up over time a sense of superiority. And it's very subtle. And it comes through somehow or another that we're in the presence of people who feel superior, even though they're kind and compassionate and loving, there's something about it that just doesn't feel, that just is off. I don't know how else to express it. And the way that this person described it, I thought was really good. A subtle sense of superiority. And I got it. I mean, right away, I would hear, before my own daughter took her life, right away, if I heard somebody had committed suicide, I started the whole number. There must have been something wrong with the mother. There must have been something wrong, you know. right away, the slipping into that, I felt superior. So I could therefore judge what was going on with another person, even though it had nothing to do with it. So I just wanted to bring that up. I can see it resounds with you, and that feels really good for me. Okay, we really do need a shift in paradigm. There are 4 points I want to make. The present psychiatric paradigm, although there are many, many wonderful people involved in the field, but the paradigm itself is not working. It's in crisis. I want to go over some things about that. Increasingly, studies reveal trauma in the histories of the majority of people in the mental health systems, behavioral health services, and addiction services. Prevalence data from now 21, it says 19 years, 21 states show high rates of adverse childhood experience similar to ACE study findings. They've now been identified by the Center for Disease Control as a major public health issue. And there is increasing evidence that a truly trauma-informed approach works. Okay, crisis, and I'm not going to go over all of this, it's just too much, but the points I want to make here. First, the National Institute of Mental Health has reoriented its research away from the DSM-5 categories, citing the DSM's lack of scientific validity. That's really important, okay? Another one, which was very interesting that I've talked with you about already, was the World Health Organization based research. Oh, no, this is different. This is based on 2 studies by the World Health Organization. Concluded persons diagnosed with some kind of mental illness fare significantly better with higher recovery rates in developing countries than in the United States and other developed countries. And they're finding this over and over again. Also, 3 international studies, I'm having a hard time seeing, my glasses I think are coming loose. 3 international studies found countries with more developed psychiatric services have higher rates of suicide. Now, they expected in these studies to find the opposite. And who was involved in these researchers? The World Health Organization, United Kingdom researchers, Australian researchers. They did study number 1, and they found that the more and the so-called better and the more mental health services existed in countries, the higher the rate of suicide when they were introduced. And then they did a second study, let's see, and that one was 2004. The next one was in 2010. They replicated the study, and they found the same rates because they couldn't believe the results. They couldn't really believe that it wouldn't impact on suicide and bring them down. Okay, and then 2013, a much larger study over 191 countries conducted by the World Health Organization and other researchers from these countries found that increased numbers of psychiatrists and mental health beds significantly were associated with increased suicide rates. So we're in a paradigm that we're kind of sticking to, but it's not really working. And it kind of makes people mad when you talk about that, but you know, you can't just ignore these studies. You've got to begin to say, well, what might we be doing wrong? You know, let's take a look at it. Have a little humility here where we're not God, we don't know everything. Maybe there's something that we can learn. Okay, so another one that comes out of this is the 2013 report. I don't know if you've heard about it, the United Nations Human Rights Council in Geneva on March 4th, 2013, states that forced psychiatric care passes the threshold of maltreatment to torture, are cruel, inhumane, or degrading treatment or punishment. And the report called for a ban on these types of interventions. That's powerful, okay? This is something that's interesting that I wasn't, but what studies have shown is the mental illness as an illness way of looking at things. The mental illness is an illness just like any other illness, approach to public education, okay, intended to reduce stigma, actually increases fear, prejudice, and the desire to distance away from the person who's got the diagnosis. So that's not working, okay? And there's increasing evidence, and I know you got this from Robert Whitaker, I don't even have to go over the details, increasing evidence of corruption within the field of psychiatry. And again, I want to stress there's some wonderful human beings who are psychiatrists, and I have a relationship with one of them. So I'm not saying it broadly, but there are a lot of powerful psychiatrists who are really getting corrupted by the influence of psychopharmaceutical money. Okay, and Whitaker has really been able to demonstrate this in a very calm, unemotional way, very much more. What I do get emotional about, what I think is an extreme moral issue and one of the scandals happening in our country today, is the drugging of children. The diagnosing of children at a very young age with these disorders, so-called, you know, even for normal behaviors, these disorders, and then prescribing medication that they don't know what the long-term impacts are on a child's brain is unconscionable and immoral and a huge ethical problem that has got to be dealt with. And that's what I get emotional about. Thank you. I actually get shaky when I think about that. I think it's just horrible. You know, I can't imagine that doing to a child. I just, anyway. And I've really made it a point to educate my children because, you know, they get influenced by what's on television. They get influenced by the thinking of the day. And if you're a busy parent, you know, my God, my kid's so active. He must be hyperactive, and therefore he must need drugs. And, you know, the school systems and the doctors are more than willing to give you a drug to calm your child down. You know, and it's just not, it's not right. It's not working. It's not working long term. But short term, you know, the child's sedated and less trouble. So you think, okay, this is working. It's another one of those BS things. Okay, so that's the crisis in psychiatry. Any paradigm shift really requires that the existing paradigm experiences some kind of crisis. You begin to learn more and more and more about the existing system, the existing paradigm of seeing things and doing things. When it's not working and there's increasing evidence that it's not working, that's when a new paradigm is beginning to come in. So that's where we begin to look at all the things like the ACE study and the neurobiological research and the numerous studies that are revealing that trauma in the histories exists in the histories of the majority of people with behavioral health issues. Unaddressed trauma, okay? So then you have, okay, with the paradigm shift, you begin to get more and more, it begins to accumulate. More and more things begin to happen that are based on a different paradigm, and you begin to take some action about it. And there are now 21 states, and I want to congratulate Nebraska. You were, when you look at when these things happened, 2010, Nebraska became involved in introducing the ACE module, the ACE questions in different forms, but the ACE questions into your annual health survey, which is called, let me see if I can pronounce this, Behavioral Risk Factor Surveillance System. It's a health survey, and it goes out to everybody in the state, and they figure out what, you know, the prevalence is of different kinds of illnesses and so on. And they've now introduced an ACE module in it. So now there are 21 states that are doing that. So different states are getting very, very aware that this is an important issue to address, whereas before they were totally not aware of it. So paradigm shift, a lot of what needs to happen in a paradigm shift to really change things is that we open our mouths and talk a lot. And we talk a lot about this new paradigm. We talk a lot about what's wrong with the old one. But we don't just talk about what's wrong with the old one. We talk about how we need a new one and what's involved in a new one and how we can maybe combine the two. We don't have to throw everything out about the old one. But we do need a really important shift in how we see and understand people. Again, that, you know, not from the vantage point of what's wrong with this person, but from the vantage point of what happened to this person, okay. And now there's increasing evidence that a truly trauma-informed approach works in multiple service systems. And this, I'll just cite two examples, you know, because I know I'm out of time, I've gone overboard. But there are two examples here, and one of them is in the Nurse Family Partnership Program, which all over the country where it's implemented, it's an evidence-based program, is resulting in a 20 to 50% reduction in reported incidents of child abuse and neglect. But guess what they did in the state of Washington? In the state of Washington, they decided that they would educate the Nurse-Family Partnership Program with the ACE study. Now, the Nurse-Family Partnership Program is a program where when a woman gets pregnant, a nurse comes and helps her with the pregnancy and begins to educate her around parenting, begins to educate her around care of the child and so on. And that nurse stays with that woman for the next 2 years. So you're talking a real solid intervention. And they've been able to reduce reported incidents of child abuse by quite a bit. So they introduced the ACE findings and the understanding of trauma into the program in Washington. And they were able to reduce within a year, the reported incidents of child abuse and neglect by 79%. Okay? So that kind of evidence is the kind of thing that we need to talk about. It works. Now there's one more example. There's a high school in Lincoln, Washington. No, it's Lincoln High School, and it's in Walla Walla, Washington. And they introduced an understanding of what happens neurobiologically, and they introduced the ACE study to kids in high school who are having problems. Lincoln High School had nothing but the kids who were kicked out of other schools. This was their last chance. When the principal came in, the school was controlled by gangs. And this was a very tough situation. A lot of poverty involved, a lot of street violence, the whole number. Okay. They went in there. The first year he decided he would exercise compassionate discipline, whatever that meant. And it didn't work. Things remained the same. And he's a wonderful man and was, the good things that he tried to do. They introduced the ACE study. They helped people become more aware of what was going on with these kids. It shifted the way that people, teachers and all of them, there's some teachers had to leave. They couldn't do it. It wasn't based on blame and punishment anymore at all. It was based on solid education and understanding of what the heck's going on with these kids and how some of their behaviors, they really couldn't help it. They couldn't regulate their systems. They couldn't sit and concentrate in class. They were coming from a situation where their dad had just beat up their mom for the umpteenth time, and they were being evicted from the place where they lived. And here they were in school and asked to be cognitively attentive. You can't do it. It's impossible. And so the teachers and the people began to understand what was going on with these kids. And the suspension rate was up to about it was up to over 800 incidents a year, suspensions a year. Within a year, they had that down to 300. And there are many, many things that they did I don't have time to tell you about. But it works. If we can substitute the shame and blame diagnostic kind of thing, where we decide how to lay on our opinions on somebody else, and that's going to supposedly help them get better, and substitute that with a real understanding of their life and the impact of trauma in their life, then we can begin to help people to heal. And I think with that, I am going to end. Here's the Mad in America site, and that's it. Thank you. Thank you. Oh.